Hello and welcome to the channel. Today we are talking about a medical emergency that strikes completely out of nowhere and can take a life in a matter of minutes. We are talking about deep vein blood clots. Your blood is an incredible life-sustaining fluid. When you accidentally cut your finger, your blood naturally forms a plug or a clot to stop the bleeding so you can heal. This is a brilliant survival mechanism. But sometimes things go terribly wrong. For a variety of reasons, these thick, jelly-like masses of blood can form deep inside your veins where there is no physical injury at all. This condition is called deep vein thrombosis, and it usually happens deep in the veins of your legs or your pelvis. The terrifying reality is that this thick clot can easily break loose from the vein wall. Once it breaks free, it travels rapidly through your bloodstream, moving directly toward your most vital organs. If it gets wedged in your lungs, your heart, or your brain, it completely shuts down the oxygen supply, causing a catastrophic medical event. Because this condition is so incredibly dangerous, your body will sound massive alarm bells when a clot begins to form. Today, I'm going to walk you through the 7 silent warning signs of a dangerous blood clot. I will explain exactly what to look for so you can take immediate action before it is too late. The first major warning sign is sudden, unexplained swelling in just one of your arms or one of your legs. Now, it is completely normal for your feet to swell slightly if you have been standing up all day or if you have eaten a very salty meal. But the swelling caused by a blood clot is entirely different. It almost always happens on just one side of your body. You might look down and notice that your left calf looks significantly larger and puffier than your right calf, or that one of your arms feels incredibly tight and heavy. To understand why this happens, you have to picture the veins in your legs like a busy highway carrying blood back up to your heart. When a massive blood clot forms in that vein, it acts exactly like a major traffic jam. The blood can no longer flow past the clot, so it begins to rapidly back up and pull directly behind the blockage. This massive buildup of pressure forces fluid out of the vein and completely saturates the surrounding soft tissues, causing severe, localized swelling. If you ever experienced sudden, dramatic swelling in just one limb that cannot be explained by an injury or an insect bite, you must treat it as an absolute medical emergency. The second warning sign goes hand in hand with the swelling, and that is an intense, sharp pain or severe cramping in your calf or your thigh. This is perhaps the most misdiagnosed symptom of a blood clot because it feels almost exactly like a severe muscle cramp or a Charlie horse. Many people assume they just pulled a muscle at the gym or slept in an awkward position, but there are crucial differences you must pay attention to. A normal muscle cramp usually releases after a few minutes of stretching or walking around. The pain from a deep vein blood clot does not go away. In fact, it gets significantly worse when you try to flex your foot upward toward your knee, or when you apply direct pressure to the area. This pain happens because the tissues surrounding the blocked vein are being completely deprived of vital oxygen, and the massive internal pressure is actively crushing your nerve endings. The pain can feel like a deep, throbbing ache, or a sharp, stabbing sensation that originates deep inside the muscle. If you have a cramp in your leg that refuses to release and is accompanied by a heavy, painful ache, do not try to massage it out. Massaging a blood clot is incredibly dangerous because the pressure can physically break the clot loose and send it traveling toward your lungs. Moving on to the third sign, which is noticing that the skin over the painful area is unusually warm to the touch and visibly red or discolored. Your skin provides a brilliant window into what is happening deep inside your circulatory system. When a blood clot blocks a major vein, your body recognizes that there is a massive internal injury. It instantly triggers a severe inflammatory response, sending immune cells to the area to try and fix the problem. This massive localized inflammation causes the blood vessels near the surface of your skin to expand heavily. If you place the back of your hand against the swollen leg, it might feel significantly hotter than the rest of your body, almost as if it is radiating heat. Furthermore, the trapped, oxygen-deprived blood pooling behind the clot will begin to visibly change the color of your skin. The affected area might look bright red, angry purple, or even have a bluish bruised tint that stretches across a large section of your leg or arm. If you have a painful, swollen limb that is hot to the touch and changing colors, your vascular system is screaming for immediate medical intervention. The fourth early warning sign means that the situation has escalated dramatically, and that is experiencing sudden, unexplained shortness of breath. If you are experiencing this symptom, it likely means that the blood clot has broken loose from your leg, traveled completely through your heart and violently slammed into the delicate arteries of your lungs. This is a life-threatening condition known as a pulmonary embolism. When this happens, a massive section of your lung tissue is instantly cut off from its blood supply. Your lungs can no longer efficiently exchange oxygen and carbon dioxide. You might be sitting completely still on your couch and suddenly feel like you cannot draw enough air into your lungs, no matter how hard you try. It feels exactly like you are suffocating from the inside. Your body instantly goes into a state of sheer panic, causing your heart rate to skyrocket as it tries desperately to pump oxygen that is no longer there. You might feel incredibly dizzy, lightheaded, and feel like you are going to pass out. A pulmonary embolism is a ticking clock, and every single second counts. If you suddenly cannot catch your breath and your heart is racing out of control for absolutely no reason, you must call emergency services immediately. The fifth warning sign is experiencing a sharp, stabbing pain in your chest that gets significantly worse when you take a deep breath or when you cough. Because shortness of breath and chest pain are also symptoms of a heart attack, millions of people completely misunderstand what is happening to them. The chest pain caused by a lung clot is very distinct. While a heart attack often feels like a crushing, heavy elephant sitting right on the center of your chest, the pain from a pulmonary embolism is sharp, localized, and directly tied to the movement of your lungs. It feels exactly like a knife stabbing into your ribs every single time you try to inhale deeply or exhale forcefully. This happens because the clot is causing a localized area of your lung tissue to actively die from starvation, which severely inflames the delicate lining that surrounds your lungs, known as the pleura. Every time you breathe, this inflamed lining rubs against your chest wall, sending agonizing pain signals to your brain. If you feel a sudden, sharp pain in your chest that forces you to take shallow, panting breaths just to avoid the agony, your lungs are under a direct attack. The sixth warning sign is an extremely frightening symptom that you must never ignore, and that is suddenly coughing up blood. When a blood clot causes a pulmonary embolism and destroys a section of your lung tissue, it completely ruptures the tiny, fragile blood vessels that line your airways. As these microscopic vessels burst, the blood has nowhere else to go but up into your bronchial tubes. You might experience a sudden, violent coughing fit that produces a thick, bloody mucus or even bright red liquid blood. Many people panic and assume they have lung cancer or a severe respiratory infection. But when this bloody cough appears alongside chest pain, shortness of breath, or a rapid heart rate, it is the ultimate medical red flag. Your lung is literally bleeding internally because a clot has violently disrupted its blood supply. If you ever cough up blood, even if it is just a small amount mixed with mucus, you must get to an emergency room instantly. The seventh and final early warning sign involves a blood clot that has traveled up into your brain, and that is a sudden severe headache combined with neurological changes. We often think of blood clots only happening in the legs or the lungs, but they can easily travel up the carotid arteries in your neck and lodge directly in your brain. This causes an ischemic stroke. When the clot blocks the flow of oxygen-rich blood to your brain cells, those cells begin to die in a matter of minutes. The very first sign of this is often a headache that is so incredibly painful it is frequently described as the worst headache of a person's entire life. It strikes like a lightning bolt out of absolutely nowhere. But the headache is quickly followed by massive neurological failures. You might suddenly lose your vision in one eye, experience severe slurred speech, or find that one entire side of your face and body has gone completely numb or paralyzed. This is the absolute peak of a vascular emergency. Time is brain. The faster you can get emergency medical treatment to dissolve that clot, the higher the chances are of saving your brain function and your life. Now that you know these 7 terrifying warning signs, we absolutely must discuss the daily habits that cause these clots to form in the first place, so you can protect yourself. The absolute biggest risk factor in our modern world is prolonged immobility. Human bodies were designed to move. When you sit completely still for long periods of time, the blood in your legs stops flowing vigorously and begins to pool in your deep veins. Stagnant blood is blood that wants to clot. This is exactly why deep vein thrombosis is often called economy class syndrome, affecting people who take long airplane flights and sit cramped in tiny seats for 8 or 10 hours straight. But it is not just airplanes. If you work at a desk job and sit in a chair all day without getting up to walk around, or if you spend your entire weekend completely immobile on the couch watching television, you are putting yourself at a massive risk. Another massive hidden cause of blood clots is severe chronic dehydration. When you do not drink enough pure water, your blood literally becomes thicker and stickier. Think of the difference between trying to pump water through a hose versus trying to pump thick syrup. When your blood is thick and viscous, the platelets inside it are much more likely to stick together and form a dangerous clot. This risk is multiplied heavily if you are also a smoker. The toxic chemicals in cigarette smoke actively damage the smooth inner lining of your blood vessels, creating rough, sticky patches where blood clots can easily anchor themselves and grow. Furthermore, certain medications, specifically hormonal birth control pills and hormone replacement therapy, introduce synthetic estrogen into your body, which dramatically increases the clotting factors in your blood. If you are taking these medications, you must be extra vigilant about the warning signs we discussed today. The incredible news is that you have massive power to prevent these clots from ever forming, and it starts with simple daily movements. If you work at a desk or are traveling on a long flight, you must set an alarm to stand up and walk around for at least 2 minutes every single hour. When you walk, the powerful muscles in your calves contract and squeeze your deep veins, acting exactly like a second heart. This physical squeezing forces the blood out of your legs and pushes it aggressively back up toward your chest, preventing it from pooling and clotting. If you absolutely cannot stand up, you can do simple calf raises while sitting in your chair by simply lifting your heels off the floor and flexing your calf muscles repeatedly. You also have to use food as your natural blood thinning medicine. While you should always follow your doctor's advice regarding prescription blood thinners, there are incredible natural foods that keep your blood flowing smoothly. The absolute best natural blood thinner is raw garlic. Garlic contains a powerful compound called allicin, which has been proven to prevent blood platelets from sticking together. Incorporating fresh crushed garlic into your daily meals provides a massive protective shield for your cardiovascular system. Additionally, you must flood your body with natural anti-inflammatory foods like turmeric and ginger. Turmeric contains curcumin, which dramatically lowers inflammation in your blood vessels, keeping them smooth and healthy. Ginger contains natural salicylates, which are the exact same chemical compounds found in aspirin used to prevent clotting. Drinking a warm cup of ginger and turmeric tea every single day is a phenomenal way to protect your veins. Your circulatory system is a massive, brilliant highway that delivers life to every single cell in your body. It relies on you to keep the traffic flowing smoothly. Blood clots are terrifying because they strike in silence, but your body is incredibly smart and will always try to warn you. Do not ignore a swollen leg, a sharp pain in your chest, or a sudden shortness of breath. By recognizing these 7 warning signs, staying deeply hydrated, and moving your body every single day, you can keep your blood healthy and completely prevent this silent killer. Thank you so much for joining me today and taking this critical step in educating yourself. Your health is entirely in your hands. Please share this potentially life-saving information with your family and friends so they can protect themselves too. Stay proactive, listen to your amazing body, and take excellent care of your health.